The connection between sepsis and C. diff goes back to what I said earlier about the side effects of antibiotics. If somebody's got sepsis and they're on 2 to 4 antibiotics, there's been 2 meta-analyses published back in 2013, and one of them found that there's a 7-fold increased risk if you've been on antibiotics of getting C. difficile. And then another study found the same thing, triple the risk by just being exposed to any antibiotic. And so there's certain antibiotics that increase the risk of C. difficile. And the first one's clindamycin, followed by a group of antibiotics called fluoroquinolones. And then there's another set of antibiotics called cephalosporins. So we kind of know those are our high risk antibiotics that are associated with the development of C. diff. Well, the thing I'm most excited about is rapid technology that can identify the bacteria in the blood faster, and so we're very blessed right now that we have many companies that can do that. We have some that are called PCR, that within an hour you could identify an organism in the blood. We also have genotypic types of techniques, which maybe an hour and a half. A product called the MALDI-TOF, which can give you a result in about an hour and a half. And then there's the Accelerate Pheno, which also gives you a result based on a phenotype. Rather than the gene of the organism, it's looking at the phenotype of the organism. Again, 90 minutes. However, what's unique about that technology is it will go on within another 5 hours to give you the sensitivity. So the physicians need to know what to treat the patient with. And typically, an antibiotic sensitivity test, AST, takes anywhere from 2 to 4 days. And this is done in 7 hours. So by first identifying the organism very quickly, and then being able to know what antibiotics it's sensitive to and what they can treat them with will help drive that therapy to get them treated on the right, it's called optimal therapy, and de-escalate, get them off those antibiotics that they don't need, because we already know what organism it is and what to treat them with. The challenge right now for physicians is they will leave them on empiric therapy, even if they know the identification of the organism. They're sometimes not quite sure. So they'll wait the 2 or 4 days, and then that's where you start to see the C. difficile or other multiple drug-resistant organisms growing. It's not just C. diff, but we can get what we call other MDROs growing in their body. Because we got to think with antibiotics, wipe out the microbiome. The whole body is completely now a landscape for anything that wants to come in. It doesn't have the normal flora that would typically keep it in balance. And so C. difficile is one of those what we call opportunistic infections. You take the opportunity to overgrow where there's no other microbiome that should be there. And there are other species that in the presence of the antibiotic will start to develop resistance and start to grow in the presence of that antibiotic because they figured out how to get resistant to it. Yeah, so there have been many studies done. One in particular, a study called the Kumar study, showed that patients, once they start to get hypotensive and look like they're going into shock, for every hour you delay the appropriate optimal therapy, this is 7.6% decrease in survival. And so when you look at the data, at 36 hours, it's only 5% survival. So that's one of the challenges, is that our delayed laboratory test are making us wait those days to be able to give them optimal therapy. So there is a study that was just published in June in one of the medical journals looking at all the rapid ASTs that will be coming on the market. And so there's tons of research being done in that field in R&D to look at how can we get faster ASTs. The only one on the market at the moment for blood cultures is the Accelerate Pheno. So Accelerate Diagnostics has this rapid 7-hour ID and AST test that's available now and approved by the FDA. So there's another issue that comes up with sepsis called post-sepsis syndrome. And the problem there is that patients are often with sepsis in the intensive care unit for days, weeks, or months, depending on the criticality of the situation. 38 people a day have amputations due to sepsis. And so that's why if they have to have an amputation, they're going to be in the ICU much longer. Because of that, many of them have insomnia. They can't get to sleep or stay asleep. They have aches and pains in their muscles and joints. Many of them have decreased mental functioning, have nightmares and terrors and panic attacks. And there's a 42% increased risk of them committing suicide if they have had sepsis. So we're just starting to learn as we study sepsis some of those other side effects of what happens to the patient after they leave the hospital and what their quality of life is following a septic episode.